Hello, everyone, and welcome to one of our 11 Together to Goal Plank Mentor webcasts. Today, we'll be hearing from Dr. Stephen Combs of Ballot Health. Dr. Combs is the Plank Mentor for the published Transparent Internal Reports campaign Plank. Dr. Combs, thank you so much for joining us today.
Thank you for having me today. It's my pleasure to be here.
Great, so let us get started. Dr. Combs, please tell us a little bit about you and your organization.
Yes, I'm glad to. So I'm Dr. Stephen Combs. I'm currently the Chief Medical Officer at Ballot Health Medical Associates. We're the result of a merger of two systems in Northeast Tennessee, Southwest Virginia, which occurred 18 months ago. In regards to myself, I am practiced pediatrics and pediatric critical care over the past 25 years. I attended medical school at East Tennessee State University. I completed pediatric residency and served as chief resident at Duke University in Durham, North Carolina, and have completed business and executive development at the University of North Carolina at Chapel Hill. I'm board certified in pediatrics, pediatric forensic medicine, and a certified physician executive. Since 2006, I've been fortunate to serve in leadership capacity here at Ballot Health, and since 2012, I've been our chief medical officer. Now, Ballot Health Medical Associates is the multi-specialty arm of Ballot Health. We serve a 23-county region in Northeast Tennessee and Southwest Virginia. We have 800 providers equally divided between physicians and advanced practitioners. And out of those providers, we serve out of 250 locations and take care of over 400,000 patients. The Together to Goal program has been great for us because in our region, we really are in a diabetic belt, and we have a little over 24% of our patients either at risk or with type 2 diabetes. So again, this program has been great for our patients, great for our providers.
Great. Thank you so much for that information. Can you tell us now, what is your process for creating and disseminating transparent internal reports?
Yes, so for creating these reports, we have EPIC as our EMR, and within EPIC, we have taken the Plank goals, the core measures, and have placed them into a diabetic flow sheet. So our physicians and advanced practitioners, as well as our nursing staff, are able to see that when a patient comes in, and if there are any measures that need to be updated or are lacking or need improvement, they're able to act upon those at that time. We are fortunate as a larger group to have an operational development, an organizational performance team that is able to extract that data, develop it into a report card, and quarterly not only submit to AMGF, but submit that to our providers. And we actually develop 2 report cards when that comes out each quarter. Now, having said that, if you're a smaller group or even an individual practitioner, don't let this sound like it's impossible to do. This could easily be performed on an Excel spreadsheet. The data can come from your patients, and it's easily done. So that would not be a reason not to participate.
Great. So can you describe to us what kind of information is provided in a transparent report?
Yeah, so as I said there, when we send out reports, there's actually 3 reports that go out. The first is the individual physician or provider's transparent report. That report has the physician, the location, all their patients that fall into Together to Goal, as well as each individual core measure and the provider's Together to Goal bundle score. And that allows them some actionable data when it comes to the practice that I can see which of my patients are falling out or which need some advice. For the group, we send out a listing of all the physicians, the location, and the Together to Goal core measures, as well as the bundle score. And what that allows is that little bit of friendly competition within the group, as well as the ability to see where my peers may be doing better or where my partner may need help. And the third thing that goes out with those reports is a tip sheet. And not only does that talk about what Together to Goal is, it talks about each of the core measures and their definitions. It also has information on how you can find this in EPIC, how you can document it in EPIC, and how you can meet that metric.
Great. So can you tell us a little bit about what value do you think these reports provide?
So really a couple of things it provides. Individually, it provides accountability for me. I'm able to see how I'm doing for my patients. I know these things are important. The things that we ask providers to do on Together to Goal, whether it's hypertension management, nephropathy screening, hemoglobin A1C control, are things that we all agree are important for type 2 diabetics. Number two, it really allows us to work within a group. So in my office, we could say, gee, what's an action plan that we can improve? We all seem to be needing help on this, or we're doing really well on this. How do we roll that out? And then for number three, it really is a group effort to keep things together. And it really allows those peer-to-peer interactions on performing the best we can within the practice. And it really is a team effort.
Great. So we have one last question for you. How did you establish a culture for internal transparent reporting? And what, if any, obstacles did you have to overcome?
So that's probably the most important question of the day, and that's the toughest question. I'll say that first, this always takes time. This is not something you get to immediately. And our group, we had non-transparent reports that rolled out. We wanted to give our providers and physicians time to adapt to this, understand what was going on, and be able to see that the data coming to them was true and relevant. The second thing is you absolutely have to develop the trust. The physicians need to trust the program. They need to trust that the data is accurate and provided timely, and they need to have the ability that if they feel like there's a question or I just don't think that's right, that we can go back and look at that data in a collaborative relationship. The third thing that I think is the most important for the group is we never use the data as a gotcha. This is not a way to say, Dr. Combs, you're missing something. It's a way to have individual accountability, which leads to group accountability and improve the overall care that we provide to our patients. So if I leave you with nothing else, I would say this is a method to get better together as a group, not in any way to be a gotcha for any type of provider.
Well, thank you so much, Dr. Combs. This is all wonderful information, and we appreciate you taking the time today to share the value of your experience working on this campaign plank. Just as a reminder to all the fellow participants, if you'd like to contact Dr. Combs to discuss implementation of the published transparent internal reports campaign plank at your organization, please email t2gmentor@amga.org. Please check out our remaining Together to Goal Plank Mentor webcasts at our website to discover what other experts have done to improve diabetes care across the country.